You and your healthcare provider have decided that Coumadin, warfarin sodium, is the medication for you. Coumadin is used to help prevent and treat blood clots in the legs, lungs, and those clots associated with heart valve replacement or an irregular rapid heartbeat called atrial fibrillation. If you've had a heart attack, Coumadin may be used to lower the risk of death, another heart attack, stroke, and blood clots moving to other parts of the body. Now, as a new Coumadin patient, you may have questions about this medication, like how to take it, what side effects to watch for, and how it might affect your lifestyle. As with all new medications, it's important for patients to read all the literature that comes with their prescription. So before anything else, spend a few moments going over the medication guide that came with your Coumadin prescription. Review it every time you have your prescription refilled. Whenever you wish to go over the information introduced in this video, you can turn to the medication guide or call the Bristol-Myers Squibb Medical Information Department at 1-800-321-1335. And every time you go for a checkup, you should discuss your concerns with your healthcare provider, one-on-one. What is Coumadin? Coumadin is an anticoagulant medicine. This means it's used to lower the chances of blood clots forming in your body that can cause serious medical problems. If blood clots form and then break loose, they can go to your brain and cause a stroke, or to blood vessels around your heart and cause a heart attack, or other serious conditions such as blood clots in the legs or lungs. By reducing the risk of these blood clots, Coumadin helps to reduce the chance of medical problems caused by clots, such as stroke. But by lowering the risk of clots, Coumadin also raises the risk of bleeding that may take longer to stop. So it is important to make sure your healthcare provider knows all about health conditions you have. Let him or her know if you have bleeding problems, fall often, or have liver or kidney problems, high blood pressure, a heart problem called congestive heart failure, or diabetes. Your healthcare provider should also know if you drink alcohol or have problems with alcohol abuse, are pregnant or planning to become pregnant, or are breastfeeding. Do not take Coumadin if your chance of having bleeding problems is higher than the possible benefits of treatment. Your healthcare provider will decide if Coumadin is right for you. Talk to your healthcare provider about all of your health conditions. You are pregnant or plan to become pregnant. Coumadin can cause death or birth defects to an unborn baby. Use effective birth control if you can get pregnant. You are allergic to warfarin or anything else in Coumadin.
Yes. Personally speaking, I think it's important for healthcare providers to know everything about my health, especially before starting a new medication.
Next, take your Coumadin exactly as prescribed to lower the chance of blood clots forming in your body. Take Coumadin at the same time every day. It may be a good idea to write it down on a calendar or chart so it's easier to remember. Call your healthcare provider if you are sick with diarrhea, an infection, or have a fever. It is also important to tell your healthcare provider about any planned surgeries or medical or dental procedures. Your Coumadin may have to be stopped for a short time, or you may need your dose adjusted. If you fall or injure yourself, especially if you hit your head, call your healthcare provider right away. Your healthcare provider may need to check on you. Do not do any activity or sport that may cause a serious injury.
For me, it's important that I keep my medications in the kitchen cupboard. This way, when I'm cooking a meal, my medications are right there, so I don't forget to take them. I take my Coumadin right before lunch. I keep my bottle of Coumadin right by the fridge, so I know when it's time to prepare my meal, it's also time to take my medication.
Yes, I've found that there's always something new I could try that suits my lifestyle. I just started playing bridge, which I really enjoy, and table tennis has replaced biking. Who needs to worry about falling and getting a bruise?
If by chance you happen to either miss a dose or take too much Coumadin, call your healthcare provider right away. Also note, do not take a double dose of Coumadin the next day to make up for a missed dose. You must also have your blood tested regularly by your healthcare provider to check for your response to Coumadin. It's a simple, routine test, and just a small amount of blood is needed. Your healthcare provider uses this test to check your PT-INR level, which measures how fast your blood clots. Your healthcare provider will decide what PT-INR level is best for you and may change your dose from time to time to keep your PT-INR at the right level for you. Coumadin may also be called warfarin sodium on your prescription. Be aware that Coumadin and generic warfarin tablets represent the same medication and should not be taken together, as an overdosage may result. Before adding or changing a medicine that contains warfarin, first talk with your healthcare provider. You may be asked to take another blood test.
Personally speaking, getting a blood test is a regular part of my schedule. Whenever my healthcare provider asks me to, I go down to the lab and give a little blood.
My healthcare provider has changed my dose based on my PT-INR level.
As a Coumadin patient, it is important to watch what you eat and drink. Why? Well, it may surprise you to learn that certain foods can actually change this medicine's effectiveness. Because vitamin K can interfere with the blood-thinning effects of Coumadin, it's important to maintain a consistent amount of vitamin K in your diet. Avoid alcohol. You should also avoid cranberry juice or any other cranberry products. And always check with your healthcare provider when considering making changes to your diet or lifestyle. To help you keep a consistent amount of vitamin K in your diet, discuss your diet with your healthcare provider. And ask your healthcare provider for information he or she may have that lists vitamin K content in foods. Avoid drastic changes in your dietary habits. For instance, eating a large amount of green leafy vegetables when you normally do not can increase the amount of vitamin K in your system.
It's not a problem for me at all. There are many foods I enjoy on a weekly basis, and I've discovered that I can always find recipes to help control something in my diet. Vitamin K is no exception. I read the literature that came with my prescription for Coumadin, and I got a list of vitamin K content in foods from my healthcare provider. I use it every day to help me maintain the same level of vitamin K in my diet.
In addition to the food and drinks I just mentioned, many other medicines, including prescription and non-prescription medicines, vitamins and herbal supplements, can interact with Coumadin and affect the dose you need or increase Coumadin side effects. Tell your healthcare provider about all the medicines you take and do not stop or start any medicines before checking with your healthcare provider first. Keep a list of your medicines with you at all times to show your healthcare provider and pharmacist, and do not take other medicines that contain warfarin, the active ingredient in Coumadin. If you have questions about medicines, vitamins, or herbal supplements, speak with your healthcare provider.
Whenever I want to add or change any medication, vitamin, or supplement I am taking, the first thing I do is speak with my healthcare provider. He can advise me if anything I'm planning on taking can interfere with Coumadin. It's sometimes hard to remember everything I'm taking, so I always keep a list handy. That way, I'm sure my healthcare provider knows about every medicine, vitamin, and herbal supplement I'm taking.
It's also important to note that Coumadin can cause serious and life-threatening bleeding. Call your healthcare provider right away if you get any of the following signs or symptoms of bleeding problems: pain, swelling, or discomfort, headaches, dizziness, or weakness, unusual bruises that develop without a known cause or grow in size, nosebleeds, bleeding gums, bleeding from cuts that takes a long time to stop, menstrual bleeding or vaginal bleeding that's heavier than normal, pink or brown urine, red or black stools, coughing up blood, or vomiting blood or material that looks like coffee grounds. Serious side effects may also include death of skin tissue, skin necrosis or gangrene, which can happen soon after starting Coumadin. It happens because blood clots form and block blood flow to an area of your body. Call your healthcare provider right away to prevent death or loss if you have pain, color, or temperature change to any area of your body. You may need medical care right away to prevent death or loss, amputation, of your affected body part. Call your healthcare provider right away if you have pain in your toes and they look purple or dark in color. You may be experiencing a serious condition known as purple toes syndrome. Other serious side effects about which you should tell your healthcare provider right away are allergic reactions, liver problems, low blood pressure, swelling, low red blood cells, paleness, fever, and rash. These are not all of the side effects of Coumadin. For more information, call your healthcare provider or pharmacist.
Since I'm on Coumadin, I'm more careful and try to avoid getting hurt. And I watch for signs of bleeding, and I pay close attention to possible side effects. However, I'm still able to do the things I enjoy, like gardening, traveling, and spending some time with my family and friends.
Now, in a medical emergency, it's critically important that the people treating you know that you are taking Coumadin. You should consider wearing or carrying information that you take Coumadin.
I sure do. I found that you never know when you'll need to see another healthcare provider, and I wouldn't want anyone giving me any kind of treatment without knowing that I'm taking Coumadin. I filled out this card and keep it in my wallet so anyone treating me knows right away all the medications I'm taking.
Personally, I have several health conditions, so I see a few different healthcare providers. I've told each of them about every medication I take, including my Coumadin. I've made it a habit to tell them what has been prescribed to me, and I carry my medication list with me at all times because I know that other medications can interfere with my Coumadin therapy.
Store Coumadin at room temperature between 59 degrees and 86 degrees Fahrenheit. Protect it from light. Remember to keep Coumadin and all medicines out of the reach of children. In addition to seeing your healthcare provider regularly, doing your part means reading any literature that came with your prescription and discussing your condition with your healthcare provider during every visit. Remember to tell each healthcare provider that you are on Coumadin. Indications: Coumadin, warfarin sodium, is used to help prevent and treat blood clots in the legs, lungs, and those clots associated with heart valve replacement or an irregular rapid heartbeat called atrial fibrillation. If you had a heart attack, Coumadin may be used to lower the risk of death, another heart attack, stroke, and blood clots moving to other parts of the body. Important safety information: Coumadin can cause serious and life-threatening bleeding. Bleeding is more likely to occur when you first start taking Coumadin and with a higher dose. Factors that can increase your risk of bleeding while on Coumadin therapy include being 65 years of age or older, an INR greater than 4, highly variable INRs, history of bleeding involving the stomach or intestine, high blood pressure, certain diseases of the brain, heart, or kidney, anemia, cancer, physical injury, taking other drugs, and a long duration of therapy. The PT-INR test checks to see how fast your blood clots. Your healthcare provider will decide what PT-INR numbers are best for you. Your dose of Coumadin will be adjusted to keep your PT-INR in a target range for you. Tell your healthcare provider right away if you have any signs or symptoms of bleeding problems, such as the following: pain, swelling, or discomfort, headache, dizziness, or weakness, unusual bruising, nosebleeds, bleeding of gums, bleeding from cuts that take a long time to stop, menstrual flow or vaginal bleeding that is heavier than normal, pink or brown urine, red or black stools, coughing up blood, or vomiting blood or material that looks like coffee grinds. Do not take Coumadin if you are pregnant or plan to become pregnant. Coumadin can cause death or birth defects to an unborn baby. Use effective birth control if you can get pregnant. Speak to your healthcare provider before breastfeeding while taking Coumadin. Tell your healthcare provider about all the medical conditions you may have, including recent or planned surgeries or medical or dental procedures. Unsupervised patients with declining mental function due to aging or mental illness and patients with alcoholism or increased risk of bleeding should not take Coumadin. Death of skin tissue, skin necrosis or gangrene, is a serious side effect of Coumadin. It happens because blood clots form and block blood flow to an area of your body. Call your healthcare provider right away if you have pain, color, or temperature change to any area of your body. You may need medical care right away to prevent death or loss, amputation, of your affected body part. Call your healthcare provider right away if you have pain in your toes and they look purple or dark in color. You may be experiencing a serious condition known as purple toes syndrome. Many factors alone or together, such as changes in diet and medicines, including herbal supplements, may affect your response to Coumadin, warfarin sodium. Tell your healthcare provider about your diet, all prescription and non-prescription medicines, vitamins, and herbal products you are taking or plan to take. Speak with your healthcare provider before starting, changing, or stopping any of these products. Many drugs, including aspirin and other pain medicines, may interact with Coumadin. Eat a normal, balanced diet. Do not make changes in your diet, such as eating large amounts of leafy green vegetables which contain vitamin K, without first talking to your healthcare provider. Avoid alcohol consumption, cranberry juice, and cranberry products while taking Coumadin. Tell your doctor if you have any illness such as diarrhea, infection, or fever. Be aware that Coumadin and generic warfarin tablets represent the same medication and should not be taken together, as an overdosage may result. If you take too much or miss a dose of Coumadin, call your healthcare provider. Take the missed dose as soon as possible on the same day. Do not take a double dose of Coumadin the next day to make up for a missed dose. If you have any other questions about Coumadin and your condition, contact your healthcare provider.